Hi there, and welcome to Vet Club. Hopefully, I'll get Topher to add the music in later, but if you're watching this on YouTube, couldn't get the sound stuff working out. I don't have my headset on, the microphone's off to the side. Whatever, it is what it is. I am super excited to welcome Dr. Erik Hofmeister to the show. Erik, welcome. Thank you for being here.
Thank you. Great to be here.
Yeah, so Erik, you are a veterinary anesthesiologist, and you also you have a blog and a podcast. And so we're doing like a crossover special, like the sitcoms do, where, that's how I like to think about it. And so yours is focused on, I guess a lot of things, but kind of just like professional development of students is sort of the umbrella that I would give that. But you, beyond being an anesthesiologist, and you've been primarily or exclusively in university settings?
Yeah, I did my internship in private practice, but after that, yeah.
Yeah, you've been in the university setting. So you and I have gotten to know each other primarily through education channels. Like that's really where our paths have crossed. A couple publications actually that came out not that long ago, so that was exciting. So the main things you and I have interacted on, which is what I'm interested in, but we can talk about whatever you want to, but is the patient safety and then the education initiatives. But maybe start by just telling us like a little bit about yourself and kind of, what's been your path in veterinary medicine and anesthesia and how you got to where you are and what you're doing now.
Yeah, for sure. So I grew up in Western LA, Pacific Palisades, a kind of posh little suburb. And I went to the public school system in the Palisades, and most of the kids were bussed in from the inner city. And so it wasn't a particularly safe high school to go to. And I was like, I want to get out of here. And so I applied to Washington State as a junior and got accepted. And so I left. So I'm a high school dropout, never completed high school, never got a GED or anything like that.
That's
Went to
awesome.
Washington. Yeah, went to Washington. They had a honors vet program where they took, I think it was 8 incoming honors freshmen and basically guaranteed them admissions to vet school if you fulfilled other criteria and maintained a certain GPA. Yeah, so I did that. It was a two-year program, and then matriculate to vet school, and did vet school at Washington State, and then graduated in 2000. And then I love education. Like if I could be a professional student, that's what I would do. And so I found out, after you graduate, you can do an internship and keep learning more stuff. That sounds great. Let me do that. And
you didn't read the fine print, did you?
No, yeah, I was a single guy, I had nothing better to do with my time. Might as well go work 80-hour weeks. So I did an internship in private practice in Southern California, and then I really wanted to be a surgeon, specifically orthopedic surgery, because you fix them and they go home, and it's not like medicine where they're like, oh my God, they're
lingering forever. Yeah,
what's wrong with you? But surgery residencies are really competitive, and in vet school I was kind of a slacker. I didn't really pay too much attention in class, or I paid attention, but I didn't do very well on exams. So
yeah.
So I was on like the cusp of the bottom quartile for class rank. I did really well in clinics, but at Washington, the clinics were not graded. They were all pass fail. So basically
your GPA couldn't be benefited by it.
Exactly. So so I was not competitive for surgery residency. And then after the match, there were a couple of anesthesia residencies that were open. And I was like, oh, I can do that for a couple of years, and that'll make me a better candidate for a surgery residency. And so applied to those, and UGA called me up and they were like, hey, you want to come do an anesthesia residency? I was like, yes, please. And so it was originally going to be a 2-year residency, because once upon a time there were 2-year anesthesia residencies. But I was there. I was like, hey, can we make this a 3-year residency? And I ended up doing a lot of research then. And I was like, this is fantastic. Like being in academia is kind of like being a student for forever.
Yep.
And so I stayed on there. They actually gave me a faculty job like halfway through my residency, because they just desperately, needed someone.
Yeah.
And I really enjoyed that. I stayed on there until 2016. When I went to Midwestern University, one of the new schools out in Phoenix, and was the department chair for surgery there. They were just getting things set up, so they were just getting the departments organized. So
Yeah.
I kind of went out there and worked on trying to build that system. Um, and then ended up moving to Auburn University, where I am now, and I'm just a regular faculty member anesthesiologist doing that. And so yeah, I've tried to do a lot of different things. I have a lot of interest in cross-disciplinary, involving like psychology and sociology
Yeah.
topics with veterinary medicine. Mostly because it's like it's low-hanging fruit research wise. I think
Yeah.
that a
Yeah.
lot of cross-disciplinary stuff, it lends itself really well to doing easy research
Well,
projects.
because like easy, because like somebody else has kind of done this in one area and you're like, oh, let's replicate that over here. Like somebody's done a lot of the legwork, but let's just see if the same holds true here or if there are differences.
Yes.
Yeah, those are fun.
Yeah, exactly. And also, like, I think that there may not be, I think it's more true now, but at least once upon a time, there weren't a lot of people doing like that sort of cross-disciplinary stuff in vet med. And so when I introduced those concepts of veterinary medicine, it's like, ooh, this is novel. I'm like, I don't know, like psychology has been doing this for 30 years, but okay.
Yeah.
Um,
I feel that way with education stuff. It's like, oh, let's figure this out. And it's like, they've known this for like
yes.
70 years. It took me 10 years of trial and error to get to it, but somebody literally figured this out a long time ago. Oh, okay. Okay, so I have a couple questions about this. So do you think, like, when you went back and you were like, I think I want to do surgery, but you said, okay, I can do anesthesia, that will make me a better surgeon. Was it that you were just like, oh, like, actually what gets me excited isn't necessarily orthopedic surgery, but it was just that ability to move on to new things, and you were getting that in your academic position, and so you're like, I don't need to do surgery specifically? Or were you just kind of like distracted long enough that you were like, I'm not going to go back? Like, did you always kind of think, I want to go back and do surgery? Or did you change your mind completely and say, that wasn't actually what I thought I wanted?
Yeah, that's an interesting question. I have a couple of thoughts on that. One is, I think that I could probably be happy doing almost anything because, we have evidence that happiness is like 50% genetics, right? So, and I'm also a white man born to an upper middle class family, in the United States of America. Like, there's only so unhappy I could be,
Yeah.
So I've thought that if I hadn't gotten into vet school, I could have like gone to do a PhD in biochem, or who knows, I think people place an excessive amount of import on happiness to their profession and tend to underplay the importance of the people that you work with.
Mm-hmm.
Is the work interesting, like that sort of thing? And I see this in the pre-vet students all the time who are like, I have to be a vet, it's the only thing I could be. I'm like, no, you could probably be happy doing lots of stuff, guys.
Yep. Yeah. Like, you want to feel fulfilled and challenged, but it doesn't have to be in this one particular niche. Cause
Yes.
I think about that too. Like, I thought I was going to be a vet since I was a kid, but like at 5, you don't know. I had no idea. Right. So it was so much like, okay, hey, this happened to work out, which is good. But I think I have a similar outlook, and probably, genetically favorable as well. Like, I'm generally a happy person. And I feel the same way. Like, whatever my backup plan was philosophy, actually.
Oh, nice.
Yeah, that was my minor in undergrad. I love it. So that was, maybe not as like, I don't know. I'd have less debt, but also a lower salary probably. So who knows?
It's tough,
it's a trade-off. But yeah, I think about that even now. Like, if I couldn't be a vet starting tomorrow, something happened and I couldn't be a vet, I'd be like, bummer, but I'd move on, and I'd find something else to do. I worry about that. And I think this is the psychology crossover for which I am not qualified at all to comment on, but I'm going to comment anyway, is that I do think that some of the issues we have with mental health, particularly depression and suicide, is one, it's obviously very complicated, but one thing is that when people tie their full identity into being a vet, that's dangerous. That's so dangerous. And I was like, no, I'm a whole person, and this is one aspect of me, just one aspect, a cool aspect. Don't get me wrong, I love this stuff, but it's just it's not who I am. My identity is so much more than that. And so I hear that from sometimes the younger students, but even people like later in their careers, where like, if you ever start a story where like, so I was hanging out at work when I wasn't on, scheduled, like that's not good. Like, go away, go do something else. It's one thing if you get called in or you're needed there, but like, I had nothing better to do, so I went into work. Nope, Nope. That's cool that you like your job, but don't do that. And don't feel bad when you want to go home at the end of the day. I tell students that all the time. Like, we should not be making each other feel guilty because we want to be done after working a full day. Anyhow.
And I think that maybe that also there's something to be said for, your cycle in life. Like I said, like I was, a young single guy as a senior student, as an intern, like there's not a whole lot else I wanted to do with my time, and I think that there are some people that enjoy, working and putting the time in.
Yeah.
And I ended up being one of those. Yeah. And I think that it's tough. I don't know if this is a generational thing, but on the one hand, I say to people like, no, like if it's ready to go ahead and leave. Like, Friday afternoon, if we don't have any more cases, it's 2:00. I tell the students, get out of here, get some sunshine.
Enjoy it while you can. Yeah.
Yeah. At the same time, I'm not doing that, like, because I kind of like doing my job and being here, and I have like lots of stuff to do. So I worry about, not being a great, like, do as I say, not as I do sort of thing.
Yeah. I think it's an interesting point because we all kind of fall into that do as I say, not as I do on both ends of the spectrum, right? But I think probably more important than how many hours are you spending? Because people talk about work-life balance, and it's not about the number of hours you spend. It's about, like, are you enjoying it? Because if you're staying at work because you have things you want to do and you're excited, that's very different than feeling guilted into staying, or that, oh, well, other people haven't left yet, so I have to stay. Like, that shouldn't have anything to do with it. Like, you've got your work done, like you're not leaving people hanging, and you don't have anything else to do. Or maybe you have something else that you do want to do that you've prioritized. Like, that's okay. Like, it's okay if some weeks you're like, hey guys, I need to get out of here earlier because I have whatever, I have something else, I have other plans, I'm getting out of here for the weekend, I'm hanging out with friends, I'm hanging out with my nephew, like, you name it. Like, that's fine. But it's also fine to be like, yeah, no, I have this project I'm working on and it's really important to me, and so I'm staying late to get it done, and I'm missing out on this other thing because this is important to me right now. That's the balance that I see. It's not how many hours did you spend and did somebody else think it was enough. It's, I'm doing the things that make me happy, and that I'm doing the work that keeps me fulfilled and passionate and engaged, but I'm also leaving enough that I have energy left over. So I think you could still be like that. You could be role modeling that. And I think it's okay that you're saying, hey, if you guys are done, get out of here. And you don't necessarily have to be leading the way out, because some of those students are going to have things that are like, okay, I'm going to go read up on my cases because I thought this was interesting, or I want to, reinforce what I learned today. And others are like, I'm going to the movies. And all of those are okay in their own way. I think that's the hard part, is we all think that we know what it looks like when somebody is doing the right. It's like, no, it looks different for all of us, and it looks different from day to day. Like,
I love that, Bobbi. The idea that work should be fulfilling, or maybe should isn't maybe a good word to use, but hopefully like fulfilling. Yeah, you like it to be, and you enjoy doing it, but then sometimes you also like getting out and doing other things. So I think that honestly, this is one reason I really like academia, is because if it's like Wednesday at 4:00 and I've done what I want to do, and my wife and I are both free, it's like, okay, we're gonna go happy hour somewhere, but often Friday afternoon, there's not a lot going on, and so people aren't bothering me, and I do like my data analysis kind of stat stuff a lot of the time, and I enter my flow state, and I'm just like happy as can be for several hours. And
I know, you look at the clock and you're like, wow, right. I've been doing this for a long time, and you don't feel bad about it.
Yes. And that is okay, and the idea of work-life balance not being a numbers thing, I think is fantastic.
I think balance is not the right word, because it implies it should be like somehow equal, but it's like, no, right. I've gotten enough fulfillment on this side, or I feel like I've accomplished what I wanted to on this side, and now I'm going to go and recharge on this side, and I'm going to do the other things I need to do. And I think when you start to feel those obligations or stressed about, that's when I think people start to be unhappy, right? Like, I'm not doing, this is pulling me too far in this direction. And it can be in either direction, right? Like, sometimes life is hard, and you have something going on outside of work and it's consuming so much of your time, and then you don't feel like you're doing the best you can at work. Like, that also gets you out of whack. I think especially if you have a job like ours, where you're like, this is not just like a punch the clock, get my paycheck. Like, I feel like I'm contributing something. And so if things outside of work are pulling me away from that. I mean, it happens to all of us at various times, but that it works. We always blame it's like we're working too much. And like, sometimes it's the other way. It's just about how am I able to re-energize myself and recharge so that I have something to give in all these different areas. And it's different for everyone. And at different times it's different. Yeah, I think we just need to stop trying to pigeonhole and say we know exactly what it looks like, or I can observe somebody else and know what their work-life balance is. I don't know that we can. So I just try to talk about it to the students, like, hey, it's all right. On at least on the rotation, on our emergency rotation, like, you shouldn't feel bad when you want to leave. Like, hey, get out of here, boom, done. Because tomorrow you might not get to. Tomorrow there might be more things to do. And so, yeah,
exactly.
Always like, is this
Take
a
the
trick?
chance.
Yeah, is this a test? Are we gonna fail this? It's like, no, leave for real.
Yep.
And you might get to leave today, and somebody, like, ask them if they need help, and if they're like, no, I'm good, then you can get out of here. And then tomorrow, you know, try to help each other out, but don't feel like you have to stay because somebody else is either, because that'll all even out in the wash.
Yep. The problem is, like, I understand the students feeling like, is this a trap? Because I think for some faculty it is a trap. I remember in my internship I had a back dog, and I was doing it with the surgeon, and it was late, and it was like, you know, my gazillionth back dog, and he was like, do you want to help me with this? And I was like, and he was like, honestly, choose. Like, I don't care if you're here or not. I'm like, if you are genuinely saying you don't care, I am gonna go. But you know what? He did care. And that's
not fair.
Yeah.
That's not fair.
But
Yeah.
I think that maybe people don't know themselves, or I don't know. It is frustrating that.
Yeah, and so I get that, because students don't get a consistent message from everybody, and so they are always wary when you're like, no, I'd like, genuinely, like, this is really not a test. You are not getting graded on your overtime. Like, that's not a thing. And it's really unfair, because I want people to like advocate for themselves too. Like, hey, I can't tell you how many times I've had to tell students, like, hey, by the way, I'm not going to follow you around and make sure you had lunch. Like, you're an adult, and I just need you, because I'm not going to keep track of your lunch. Like, I'm going to keep track of my own. And if I start to feel hungry, I'm going to be like, all right, let me figure out if I can. Yep. Okay. I'm not saying take an hour and a half siesta in the middle of a busy ER schedule. Like, you know, plan it out and try to be mindful. Maybe give somebody, hey, I'm going to go grab lunch, just so nobody's wondering where you are, but you don't need permission. Please don't. Like, they ask like about going to the bathroom. Like, this is not prison. Just go to the bathroom. And then I hear, well, when I was on this other rotation, like, I was in the bathroom, and it was like, where have you been? And it's like, wait, really? So sometimes I think they're making a bigger deal out of it than maybe it was, but other times I'm just like, well, maybe we are sending the signal, like, you need to be telling somebody when you're going to do, like, really? Is this prison? Is that what we're trying to do? You know, you get your hall pass.
Inconsistent messaging. And
Yeah.
I feel that pretty hard with the students as they transition from the first couple of years of the curriculum to the clinical years of the curriculum, because I feel, and I haven't sat in the classes, so I can't say this for sure, but I feel that a lot of the stuff they get examined on, tested on, is minutia and detail stuff, and not like part of the bigger picture. And maybe that's true for the clinical courses as well, but it really bums me out when I hear the students talking about, you know, studying and memorizing this minutia stuff, and I'm like, oh my god, I super don't care about that. Like, I do not care if you could tell me the MAC value of ISO. This is
because it's right here. It's
exactly
right here. This is why I tell them
you
all
have
the time.
access to all of human knowledge in your pocket. You don't need that.
Literally right there. Yeah. Well, I'll be on clinics. I'm like, okay, you're out in practice and you don't know the mechanism of action. What are you going to do? And they all kind of sit there blankly, like, I'm like, no, like, literally, what are you going to do? And finally somebody's like, I'll Google it. I'm like, you're going to Google it. Of course you're going to. That's what I'm going to do too. Like, that's what you're going to do. So get your phones out and Google it. Let's do it right now. Okay. Now, how do we use that? Like, how do we figure that out? That's what I want you to do, is how are you maximizing your resources? How are you doing it efficiently? What are you doing with that information? Like, why do you need to look up the mechanism of action or the MAC of it? Like, how are you using that? That's what's harder to just like find in a moment. Like the factoids, the numbers, the doses, the mechanisms, those are easy to Google. Like, don't ever memorize an equation ever again. Like, you don't need to, because it's literally in the palm of your hand. And our knowledge has expanded so much that you can't keep it all in your head, and it's not realistic to try. So I'm like, I want you guys to be thinking. It's the process that I care about. And I think that's probably where, I don't know about you, but that's where I get into the education stuff, because I'm like, okay, the thing I care about is like critical thinking skills, problem solving. It's so much harder to teach. It's so much harder to assess, but it's also all I care about. Like, because the rest of it is literally searchable in a matter of seconds.
It's all in service to that.
Yeah, exactly. I mean, yes, there are certain things that, you know, it's going to make that process much faster if you have that baseline knowledge, but like, don't worry about having every tiny little thing memorized. And one of the things I do, you were talking about exams, is I don't like multiple choice exams.
Oh, no.
I mean, I like
Terrible.
grading them. I do
Right.
like grading multiple choice exams, but I just, so I give, there are some multiple choice questions just to kind of speed things up for like just general recall, things that I want them to know, but very little. Like most of the exams I use are short answer, short essay, some fill in the blank kind of things. And it's funny because like some of the students really like it. They're like, yes, we like this, but it's different for a lot of them. And they get very itchy about it. Because they're also like, when I have my rubrics, it's not, this is the answer. It's, if you said this, then these are the acceptable answers. And if you said this, then these are the acceptable answers. And I think when they realize that, they appreciate the opportunity to like share their thought process. There's obviously challenges with that. It takes me a lot longer to grade and, you know, creating, but I think I've got a pretty good system where my rubrics are fairly, so I can be consistent and fair. I mean, somebody always gives me an answer that throws me for a loop. I'm like, oh, okay, what am I going to do with that? But generally speaking, I think I can be pretty darn fair and consistent with them. And I just like it so much better. And I get like excited. It was a couple of weeks ago that I was grading the midterm for the third year ECC course. And I was like, oh my God, they're getting this. Like it was just really gratifying for me, rather than like, did they guess on that multiple choice question? Like, I don't know what they've learned, but they're telling me their thought process. And I'm like, yes, they are understanding this stuff. And it's very exciting.
Yeah, I started doing basically essay only exams, I don't know, 10, 12 years ago. And had the very identical experience with the students. Like a handful of them, most of them are like, I don't understand, why can't you just give us multiple choice questions? Because that's what they've been trained to do for their whole academic career, right? And you know, we're asking them to do something different, and it's a little bit unfair. And I think, you know, sometimes with our selection process for admissions for vet school, it's like we're choosing you based on how you've done in this very traditional academic role, and then you come into vet school, and maybe for the first year, you know, or two, you're still in that traditional role, and then we ask you to start thinking about things, and they're like, whoa, what is this? And
thinking about things where there isn't even a single right answer.
Oh man, so I do script concordance questions, which is like you give them an a case, and then with this information that makes this diagnosis much less likely, less likely, neither more or less likely, more likely, or much more likely. And they hate that because they don't want gray. They want to know it's this a diagnosis if you're given this information. I'm like, sometimes we don't know.
But that's going to be jarring for them whenever it happens, and it's gonna happen. So do we want to wait until like they're in clinics to be like, hey, by the way, all those things that you thought had right answers, throw that all out? Like, it is jarring because like you said, you know, from kindergarten on, we're like, here's the one right answer. That's how things go. You know, obviously they understand some gray area, but they're like, what's the answer to the test? Like, what's the answer? And then if we spend the first 2 or 3 years in vet school with the same mindset, it's even more jarring when they get to clinic. So I'm trying to introduce them to that earlier, and you are too. So yes, it's jarring, but it's going to happen now or it's going to happen later. And I kind of rather you start easing into it now. And I do, like, conceptually they get it. Like, you can say that to them. Like, I've yet to have a cat come in and say, hey, do I have A? Do I have B? Do I have C? Like, that's, you know, that's not how it happens. And so I don't care. Now we have here at Virginia Tech pass fail for everything, the entire curriculum. So that helps.
Wow, that's fantastic.
Oh my God, I love it. I love it.
Oh my gosh.
And that helps with this because we're basically saying it's not, did you get every little question right? It's are you getting it? Like, do you know enough to be a vet? Like, that's ultimately the question. Can you do this? And so I think I'm a huge fan. And obviously your reaction suggests you like that idea as well. It's awesome. I friggin' love it.
That is great. Yeah, I definitely championed that, doing that at Midwestern, and left before made much progress. And I would like to do that here. I haven't been here very long, you know, just a few years, so I don't really know, but I have the impression that we are very traditional in a lot of ways, and that making that kind of sea change is going to be like, that's going to be a tough sell.
Yeah. It does. I wasn't here, so that had already happened before I got here, because I've only been at Virginia Tech a couple of years too. But and it's new. I think actually our class graduating this year might be the first one that went the whole curriculum as pass fail. So it's still recent here, but like I love it. Like I think it's so good.
I mean, 100%. And like every med school is pass fail, right? I'm like, we have the model, you guys, just copy and paste. I don't see the difficulty.
I know, right? Well, and I think as more and more the competency-based education gets big, you're going to have to, because that's just not conducive to letter grades. It's not. And so, so that's been like super exciting. But I think the other thing, and so I wanted to talk about this because this is the other thing you and I are part of, and you've taken a much bigger leadership role in this, is the idea. I don't know if it's a movement or just a move in veterinary medicine to really start to prioritize and recognize specific training in education as an educator. Because like historically, you become a veterinarian and you're a content expert, and they're like, you're also a teacher expert. And it's like, well, no. So maybe you can share a little bit about like what the overarching philosophy goals are with what we should be doing with education in veterinary medicine.
Yeah, the thing that it makes me think of, so I've done martial arts since I was a teenager. I think this is 30 years this year. And so in martial arts and most other sports disciplines, you learn to be a teacher by what we call the apprenticeship of observation, where you see someone teach and then you carry on with their teaching strategies, which often are frankly not very good strategies. And so this is how you get martial arts instructors who are just bad. They're just bad teachers because they're just copying what their instructor did and doing the same often without reflecting on it any, and certainly without having any formal training. And even formal training, I mean, like we did in Athens at our martial arts schools, we did a certificate for instructor training, or CIT or something like that.
Yeah.
It was just like a weekend workshop. We brought people in and we're like, hey, like, let's talk about basic principles of teaching. And like, this is how, people learn. And I feel like even doing that amount of some basic, how to teach was helpful for those instructors.
Absolutely. Yeah. Just spending any time, with that metacognition, thinking about thinking, okay,
Right.
Like, how does this work? That's going to have an effect. Obviously, a weekend isn't going to compare to years long, of a PhD or master's, but it's better than zero.
Better than zero. Exactly. So, so I think that we all realize that we are subject matter experts in our specialty discipline, and then we get to an academic role and we're asked to teach. And it's, again, the apprenticeship of observation. Like, what did you see your mentors do when you were a resident, or what do you remember from vet school? The lecturers doing, and trying to copy that, and with predictable results. Which is not necessarily bad, but highly variable.
Yeah.
That some people take to it really well, and they've picked up good lessons, and they try to apply that. But even those faculty that are good, and by good I mean that like maybe get good student evaluations and that kind of thing, they may not have learning objectives, in their slides. And so it's like, okay, well, where are you writing your multiple choice questions? Like, what do the students need to focus on? Just what I consider simple things like that, even people who have been teaching 20 years who get good student evaluations aren't doing.
Right. But so the funny thing too, is nobody has taught them as teachers to do that.
Exactly.
Right.
Exactly.
I mean, you get to this, you're like, okay, I'm a veterinarian, I'm an expert. Maybe I've gone on and specialized. So I'm a specialist. Like, I've done all the things. And it's like, no, you actually have no idea how to do these things. And so I understand that idea of like, oh no, I've reached the point in my career, I don't have to learn more stuff, right? It's like, well, I would say if you want to teach, you do, because there is a lot to that. And like, what are you teaching? What are your goals? What do you expect your students to be able to do at the end of this? Are very basic educational questions that I wasn't asking that long. Like, that wasn't that long ago that I was like learning objective. I mean, I understood what those words meant. I understand, like but I didn't realize like, oh, that's a specific thing. There are rules essentially associated with learning objectives. Like oh, okay. And they all make sense. Like, it's not complicated stuff, but you're like, oh, you just need to be thoughtful about it. you need to think about it. The same
Right.
thing. It's so funny. Like I had an epiphany years ago, but like the same things that I was like harping on my students about for like the medicine stuff. Like, I want you to just think about what you're doing. What's the reason behind what you're doing? And I was like, oh, I'm totally not doing that when I teach. Very
Yeah.
pot kettle sort of
Oh
situation.
my gosh.
And like evidence-based medicine, we got evidence, but what's the reason behind what you're doing? Except when you're teaching, just do whatever the heck happens and hope for the best. Like I wouldn't accept a student treating a patient in that regard. So why on earth am I accepting that strategy for my teaching? So I had this like epiphany, and then I felt very guilty for a while. It's like, oh geez. But that really, like, it just struck me, and that was it for me. I was like, okay, I got to do some work. And because it takes work to think about this. And but man, it's worth it, right? Like the results, it's not that I've gotten everything right since then. There's been a lot of trial and error. And that was my method for a long time, was trial and error, like just thinking about what I'm doing. And then it's like, oh no, there are people who study this and know it already. Like they can tell you why that didn't work, and maybe why this would work better. And so, I mean, really that's the kind of the point though, right? We need veterinary educators who are doing the work to be better educators.
Yeah, exactly.
Okay, so my question for you is, like, what would be your vision of how veterinary education would look, say in like 15, 20 years, 50 years? Like what would that look like in terms of who is doing the educating? What does it look like? How is that sorted out? Like what would you design?
Probably unpopular opinion. So I guess hopefully I'm never going to run for veterinary political office. The vast majority, what do our graduates do? Right? They go into general practice, primarily small animal. Now, I think that we should be still training vets to be researchers and, One Health, public health people and all of that. But at the end of the day, at least right now, most of our graduates are going into general practice. So my personal belief is that that's what we should be preparing them for. Yeah. And you know what tertiary care hospitals are good at? Training specialists, not training general practitioners. Yeah. No student in the world needs to know how to do a PDA surgery when they graduate vet school. And I would argue those are not particularly great teaching cases for them, like from anesthesia perspective, right? It's like, okay, we're going to talk about anesthesia for PDA. Are you ever going to do this? No. So I need to look at, okay, what are basic principles of anesthesia that I can use this case for to teach you? Yeah. But would I rather have you do a gazillion spay neuters and dentals? Yes. Yeah. So that's what if I was in charge, I would say, like, okay, we obviously need tertiary care hospitals.
Right.
And we need to train residents and specialists, but I think that we need to do a different job training vet students. And I think that we probably got here because in human medicine, everyone does do a residency, right? Everyone does have a specialty. And so I guess if we went that direction with veterinary medicine, then it would be fine to having the tertiary care hospitals. But until or unless that happens, which I don't think it will, I think that we should have our tertiary care hospitals, and then we need to have our primary care hospitals, and we need the students need to spend most of their time in primary care. Yeah.
And who would be doing the teaching and training?
I think that it would be general practice people, or general practitioners. Like, you don't really, let me think about this. I don't think that you really need an anesthesiologist to teach you anesthesia, except insofar as GPs have a lot of misconceptions about anesthesia. So I would be a little bit anxious about just grabbing a GP and throwing him into teach anesthesia, because I think that some of the information they give would be like actually wrong. But on the clinic floor, same kind of thing. Like, I don't think that you really need an anesthesiologist to be teaching you basic principles of anesthesia.
No, but you might need an anesthesiologist to like review the material and like ensure, quality assurance kind of stuff.
Yes, exactly. Yeah. Exactly. Right. Yes.
Yeah. Would just anybody who becomes a veterinarian gets to teach the next generation, or would you envision more like requirements or credentials to teach?
Yeah. So it would ideally be people who who have been in practice for several years, maybe, have an internship or that sort of equivalence or ABVP boards to indicate that they have achieved some level of expertise that is
Yeah.
acknowledged in terms of being general practice knowledgeable. And then, yeah, ideally having some kind of certification to teach. Because look, here's the thing, our K through 12 teachers, you can't teach unless you have a certificate. I have a friend of mine who has a doctorate in musical arts, and he is teaching high school music, and he needs a teaching certificate to do that. And it's this pretty grueling 2-year process, like every Saturday and all this nonsense. Whereas if he taught at a community college or a major university, he would need none of that.
Yep.
Which is bonkers.
Right? I know. I mean, I think it's good that, to teach in high school that you have to have those certifications. I mean, I don't know specifics and maybe they're too much or not enough. I don't know. But like the fact that we're saying, hey, in order to teach other people, we're going to need you to demonstrate that you can do it effectively. Now, again, we can have an argument about whether or not that's what those certificates provide. That's another, but at least conceptually, we're saying not just anybody can walk in off the street and teach our children. But I guess because you're an adult, they just go, whatever, anybody can come on off the street. If they have whatever random qualifications we've decided are important for this, again, content expertise is important. I'm not saying it's not, but maybe that's not the whole scoop. Because I think everybody has experienced learning under somebody who is like unequivocally an expert in what they do, but isn't good at teaching it, and isn't good at facilitating other people learning it. And then the opposite is true. Like we've all experienced like people who just teach in a way that you're like, yeah, we get this. This makes sense. Like I like this. And it's not the same person for all of us. Like one person you might work under and be like, this person's amazing. And I might be like, what? I didn't understand anything they said. Like, it's not always a one-to-one, but I do think there is, I would argue in veterinary medicine, not enough value currently placed on that additional training in how to teach. And
yeah, for sure.
That's what I would love to see, over time. Again, it might take 50 years, but I would like to see that at a minimum, you've done some training. Like, even if it's just every school has their own, like, as you're arriving, like, okay, before you teach a class, like you have to go through all these things or check off these boxes to make sure you know what a learning objective is, like, that you understand the concepts, behind adult learning and how it's different from, adolescent learning, those kinds of things. Like there's some basic things, I don't know exactly that we would all come on to agree on what those things are, but like something, give me something.
I also think that the subject matter experts teaching their discipline is maybe not the best thing, only because I've seen plenty of like anesthesiologists teaching anesthesia. I'm like, oh, like they don't need to know this, you guys. Let's move on.
Yeah. Again, I think the quality assurance is good, but I can remember from vet school being taught nephrology by a cardiologist and being like, yeah, this is good stuff. Being taught cardiology by a cardiologist, and I was like, Eisenmenger syndrome. Why do I even know what that is? I shouldn't even know what that is, honestly. And so I do think we're not always, I mean, I fall into that trap too. Like there's things that I nerd out about and I'm like, everybody's eyes are glazed over and I start talking coagulation stuff. And I'm like, I don't care because this is awesome. And it's like, no, somebody needs to stop me and be like, they don't actually need to know that.
And what's interesting to me is when I get trapped in that is when the students ask those esoteric questions, but then I try to phrase it as like, all right, you guys, this is not something you need to know. I know the answer, and so I'm going to give it to you because you asked, but do not, this is not walk around knowledge for a GP.
No, yeah. But it's hard too, because you're also like, but this is the stuff I get excited about. And so somebody asks the question, you're like, yes, let me, wax poetic about this for the next 20 minutes. But it is hard because you are excited about it, but also you need those checks and balances. Like that would be I almost feel like, could they be team taught? Like you have the content expert and then you have the education expert and they're constantly like checking in with each other.
Yeah.
Because then they don't even have to be a veterinarian, right? But you'd always have somebody asking like, is this genuinely what like they need to be able to know? Because that, that seems a little out of reach for the average person. And then maybe you have some like veterinarians that are just general, like checking in on the content expertise part. Like No, we're not going to do that. I mean, when I took over the ECC course when I was at Florida years ago, and I changed a lot. We had lectures on dialysis. We had lectures on mechanical ventilation. And I was just like,
oh my gosh, no.
That should be maybe a 30 seconds of a slide
Right.
maybe,
Yeah.
like I could give you that, but like a whole hour long lecture. I mean, and it was somebody who loved doing it. It was super excited about it. It was probably a really cool lecture. I didn't attend it, but but no, like this is just not I was like, maybe we could have one on block cats. Maybe we didn't have that before. Maybe a GDV talk. Maybe, things they're going to see and do.
Things they're going to see. Yeah, for sure.
Yeah. So yeah, but you need that outside perspective because you get caught up in your own stuff. And again, I don't think people it's not like, oh, they weren't making an effort to do a good job. It's just
right.
And
then the problem there becomes faculty autonomy, that I can imagine sitting down, because I did this with the pharmacology faculty when I was at Midwestern, and I sat down like, oh, can we look over like the anesthesia drugs that you're teaching them? And they did. And, there was this like sense of defensiveness. And so it was hard to like navigate that social dynamic, right?
Yeah.
That I was like, okay, so like I see you guys are talking about halothane and like that's interesting, but like on a practical level, that's not really something that students need to know about, and thiopental, but I feel like if we all entered into it as the spirit of we need to train students to be competent GPs, that would facilitate those conversations. But even getting that buy-in, like I think that is probably not a statement that people would agree with.
No, and I think where that one comes down, I've thought about this a lot, is I think what happens is people start to worry that they are becoming obsolete. Like,
oh, interesting.
Like, I think it's a fear. Like, if you don't let me talk about these things, like, I don't know, I don't want to talk about alfaxalone because that's not what I like. It was good enough for me. It's good enough for them. And it's this defensiveness because I don't know, it's this loss. I feel like these people almost like grieve, we can't teach embryology anymore. And so the embryologists are like, this is ridiculous. And everybody else is like, nothing has changed in how we practice medicine when we took away embryology. And it's hard because I'm like, I really want to talk about this stuff. And if somebody said, no, we don't think that's important, I'd be like, well, what? But it's so important. Of course, this is important. I wouldn't talk about anything that wasn't terribly important. I mean, I would, I do all the time, but I can certainly empathize with that, and over 20, 30 years of a career, the profession changes a lot. And you almost have to go through like a grieving process to be like, all right, we can't talk about halothane anymore because you even use it. Yeah.
or ideally embrace it. Like I've been spending a lot more mental time anyways, thinking about talking to the students about communicating with the clients about anesthesia risk and what happens if they have a problem with anesthesia, worst case scenario, fatality. I'm like, I think this is time much better spent than coming up with an anesthetic protocol, because frankly, you can give the same protocol to lots of different patients, they'll be fine. But if you know how to communicate with the client about it, I think that's going to be a much more effective use of your mental brain space.
I love that you say that. I do the same thing when I talk about CPR. We talk so much more about the client communication on CPR, when you should even be doing CPR. Should you do it? Should you not? All of that. Yeah. And it's like, once they've died, like honestly, you should spend so much more energy into preventing them from dying. Once they've died, like your odds have just dramatically decreased, right? And so I really want you to think about all these other things. How are you going to prevent it? How are you going to have the conversation with the owners? Are you even offering it in every situation? Like, do you understand that you aren't required to do it? Like, I think you ethically should be honest with people, but if you say, we're not going to do this, you can do that legally, you're allowed. And students are like, wait, what? They don't even think they have any say in the situation. So I spend so much more time talking about the communication around CPR than I ever do about doing chest. I mean, we talk about chest compressions when we talk about that, but like beyond that, I'm like, you just need to know how to talk about this.
Yep. No, that's absolutely, I spend 80% of my CPR talk time talking to them about it. But part of the problem is that we're also not modeling good behaviors where we're like, it's like, oh, we have this pet, it arrests, we start doing compressions, then we call the client and they say, stop. I'm like, why did we even start? Like that was a failed communication when that patient came into the hospital.
I was talking with some folks today. So a thing that I've introduced here that people are starting to get used to is a code status that is doctor's discretion. Yeah,
yeah, I mean, they should all be. They should all be. I mean, you got a 13-year-old golden with end-stage lymphoma that's swirling the drain and had a gazillion transfusions. Like, I don't care if you want me to resuscitate that dog. I'll be like, compress, it failed.
Yeah. But I tell the students, like, this was a conversation I had with the client, right? So when they come in on ER, for me, I don't necessarily know the whole situation right now. So it also could change. And so I don't know what I'm going to recommend right now. And I don't know if it's going to be the same that I'll recommend in 3 hours when we get all the test results back. So the conversation I have with the client is, so here's the situation in the event that, and I teach students, like, don't say arrests because they don't know what that means. Say died, like don't use euphemisms because they know what died means. They do. But when they say, if your pet suffers cardiopulmonary arrest, and people are like, okay, do you want us to do CPR? And they go, yes, because they don't know what that means.
Because they don't know. And also they think it's going to work because they've watched House.
Mm-hmm. Mm-hmm. Yeah. And so, yeah, I have that conversation with them too. And, but then I'm like, I say, or what you can tell them is, I don't know enough about your pet right now, but what I can say, as we gather information, if your pet does happen to die under our care, there are certain circumstances where I might feel that we have a reasonable chance of getting him back to a good quality of life, in which case I would recommend we do CPR. But if in my estimation, we don't have a good chance of getting him back to a reasonable quality of life, then I would not do CPR. Does that sound like in line with what you would want? And they go, yeah, that's what we want. And so
that's fantastic.
Other people are starting to offer that too. So now we have, in our hospital, we have 0, 1, and 2. So 0 is a DNR, 1 is closed chest, and 2 is open chest. And I'm like, that's not a client decision.
No. It's arbitrary, and you're going to spend the time to educate the client about the distinction amongst those. Yeah.
Right. But now if it's one that I say, hey, what I know about your pet is if it dies, we need to do open chest, I'm going to have that conversation. Like, and if it's no, then I'm probably going to say, then we're not going to do it. But I have that conversation with them, and it's amazing how often the clients are like, yeah, that makes sense. And so I'm starting to see it now in cases that I'm not involved in. I'm starting to see the doctor's discretion, which makes me so happy. Yeah. But it's so important that we have these conversations. This is the stuff that they need to be ready for.
This is what they need to know
after graduation. Yeah. Because they can do CE because they're going to have to, right? If you're going to do CPR, you're going to have to keep practicing. You're not going to be done at vet school. But like, if nobody ever talks to you about this stuff, you're going to go out there and just keep perpetuating the same thing. All right, we'll wait until it dies, and then we'll call you and ask you if you want us to keep going. Yes.
Oh God, that kills me.
Me too.
Yeah.
Anyhow.
The other thing about veterinary education in the next 50 years that this struck me when the pandemic hit is I was teaching the cardiology course because we didn't have a cardiologist at the time. And I was like, this is dumb.
Yeah.
Why are 30 plus different schools teaching the same thing right now? Couldn't we all do this like in a coordinated fashion? Maybe there's a fall semester and a spring semester cardiology, depending on like where the curriculum aligns. And that way, every single school wouldn't need to employ at least one, usually more, cardiologists. We could just have that content delivered virtually. We would have to have like a bunch of TA type people, or people that could interact with the students on an individual level and do assessments.
Well, this could be like your GP/education experts too.
Yeah, exactly. Yeah. But why are all the schools having all these specialists to teach all these classes independently? This is ridiculous.
Yeah, it's not a very good use of our resources, is it?
No.
Especially since we don't have enough of all of these people.
Right.
You'd free up a lot of people to see more cases and to train more interns and residents if that's what we decide we need. Yes. Yeah, I love that. I think one thing that that the pandemic has done is it has opened up people's ideas to those types of things. So I think we as a community would be more receptive to those ideas now than we would have been 3 years ago.
For sure.
Because we've definitely seen a lot of that, like, okay, guys, we're all struggling. What are you guys doing? There was a lot of sharing of resources over the past couple of years. A lot more, people are a lot more open to the idea of virtual learning, supplemented by, like in-person coaching and feedback, I think would be a really, really cool model. And I like the idea of, curating like a curriculum that we say we all agree with and endorse. And not that it's this is the one right way, because that gets back to what we were talking about before. Like, here's the nuance, here's the situations where there's disagreement, here's where we don't all, and we just teach the students that from the get-go, that it's not, because that's the other danger I think at a school is you have, if I'm the only criticalist here and I'm teaching critical care, then I'm teaching and implying, even if I'm not stating explicitly, that this is the one right way. And then they leave and they're like, you know, so I try to make a very big point, like, this is one thing, you know, like, this is just one way of looking at that. I don't even want you guys, in fact, I don't want you guys to leave here and do things the same way I've done. Then I haven't done my job. I want you to go out there and be better. I want you to go out there and challenge the norms and do things better than I'm doing it. That's
although the struggle that I've seen with that is, like, if the students have different faculty on the rotation, then then they get confused, right? Because they're like, okay, Hof's telling me this thing, they're telling me this other thing, like, what, like, where do they don't have, like, the residents, that's fantastic. The residents need that, but I worry about the students getting too many messages and they're not quite sure.
I wonder how much of that, and I don't know the answer to this, because that is absolutely the other end of that spectrum, right? Is that the more variety they are told, the more they're like, we shut down. They smoke comes out of the ears and they're like, we got nothing. But if we started earlier in the curriculum, implying, like, not implying, explicitly telling them, there are multiple ways to do this. There are multiple correct answers to this question, because I think that's where the disconnect often happens.
Yeah,
there's one right answer, there's one right answer, and then we get to clinics and there's multiple right answers, and that's hard. But if we started prepping them earlier, would that potentially alleviate some of that, you know, mental distress where they're just like, I just need to just tell me what the right answer is. And it's like, I can't, because it doesn't exist as far as we know.
Right.
I don't know. So I guess we'll check back in like 50 years and see how things are going. But this was really fun. It was really fun. I feel like we could go on for hours and talk about this stuff. And so you'll have to come back and we'll have to continue the conversation and see what other things that we can, I just like blowing up systems. Like, that's my thing.
Yes. Me too. Like, yes.
You know what? Let's just start from scratch.
Right.
I hate the idea of that can't work, because I'm like, no.
Yeah.
Let's open up, like, how could we make that work? That's my favorite. So yeah, I like the idea of just throwing out the current model, starting from scratch, making it make sense, and everything's on the table. So I love your see, I don't even feel like your ideas are all that radical. I know I do the same thing. I'm like, what if we did this? And people are like, what? It's like, it doesn't feel that radical.
It's when I learned the word iconoclast, I was like, that's what I am.
Yes, exactly. It's perfect. I love it. Very good. Well, thank you again for joining me, and thanks for having me on your podcast too. So we'll definitely do some cross promotion, and so I'll probably put the links to the podcast you and I did for your blog on our channel, and we'll see. But anyway, thank you so much, Erik, for coming and talking. Fantastic. And you'll definitely have to come back.
Great. Thank you.
All right.